Scott Wimpy here from First Aid, Accident and Emergency. Congratulations on the bubs or the pregnancy, and I'm here today to help you with first aid care and treatment for your new baby. There's some really important tips, but it's also important to remember that this does not replace a general first aid course. So if you need first aid training or mums and bubs training, you can visit our organisation. First of all, with any first aid course, it's important to remember to stay calm in any emergency situation. So being calm and positive will also reflect through to what you do with your new baby and also bystanders on the scene. So remember to stay calm and positive. We talk about doctors A, B, C, D. With the doctors A, B, C, D life support chart, the first protocol is to check for danger and ensure safety for all bystanders, and this includes bubs. So if bubs is in a cot or in a situation where they look unsafe, then remove them from the danger or remove the danger from bubs. Okay? I'd like to think that you can actually treat baby quite effectively by putting them on the ground or holding them in your arms, and you can also do good care and treatment here. So checking for danger, all right? The next thing you need to do is, once you've removed danger, is try and get a response from baby. Now, a good adequate response would be to grab the hands. Bubs, can you hear me? Bubs, wake up. Okay, little bit of a pat, and just to check and feel and see if baby has any kind of tone or will wake up on command. Alright, now we don't encourage waking up a baby if they're not sick, but if the baby is sick or injured, then if you can wake them up and get some kind of response, this will help you to assess them. It's a general assessment that we do. Okay, if you cannot get bubs awake and get any kind of response, the next step is to send for help. One of the great apps that we recommend here is Emergency Plus. Now, this app will help you to call an ambulance and give them the important information they need. The first thing they're going to ask is, whereabouts are you? This app will pinpoint your location. You'll be able to tell the paramedic service exactly your location, whether you're in a park or at home or wherever you are, and you'll be able to put the phone on speaker and call through that app. Alright? The other important things that the paramedics will need to know on the end of the phone is what's happened and what you've done. So if you start telling them this information, they will dispatch an ambulance to you if it's needed, and they will also start talking you through the steps of what to do until the ambulance arrives. After you send for help, it's important also to check airway and breathing. So checking airway and having a look in the mouth and seeing if there is anything in there. I would not recommend putting anything into the bub's mouth when they're on their back. So what we like to do is put the bubs into what's called recovery position or into a side stable position, using a small finger and doing a single sweep to clear anything in the airway. Of course, if you can see something in there, then by all means grab it out. But do not reach all the way down into the back of the baby's anatomy or upper airway, because that could cause major issues. Just doing a finger sweep will be enough to clear. We're also at the same time going to be checking for breathing. Now, we've taken a pulse check out of all of our first aid protocols, and the Australian Resuscitation Council have recommended this because in certain situations, particularly with an airway blockage like drowning or choking, then the heart can still be going for 3 or 4 minutes after this happens. So quite simply checking for breathing. If the baby is breathing, we are going to feel, look, and listen for breathing. It's recommended that we do this for at least 10 seconds. If breathing is present, what we need to do is keep bubs on their side, nice and comfortable, cradling bubs and talking to them and reassuring them until the ambulance have turned up. The next step is, if the baby is not breathing, we're going to start with compressions or breaths and compressions. Now with smaller people, particularly up to 12 months of age with babies and infants, with a normal airway on a baby, we like to put the head in what's called the sniff position. So this position is medically termed the sniff position for a neutral airway. If you put the baby's head back or forward, you can possibly close or occlude or block the airway off. So we want to make sure if the baby is not breathing, then we put the head in what's called a neutral position and we deliver 2 puffs of breath. Now because babies adapt to breastfeeding, they can breathe and eat at the same time. They have a reticulating breathing cycle. So I need to go over the nose and mouth so I do push positive air into the airway. I'm just going to give 2 puffs and show you how this looks. The correct head position. Now you will have noticed that the chest did rise and fall, which means I'm doing this effectively. If the chest is not rising and falling, then the head might be in the wrong position or the airway might be blocked. Have another look in there and check. From here, if I am getting adequate rise and fall of the chest, I'm going to get 2 fingers. I'm going to have a look at the baby's thumb. Now the baby's thumb is only this big. My thumb is this big. If I'm going to do compressions on anybody, you can have a look at their thumb and you would compress their chest the size of their thumb. So adequate compressions on me, being an adult, would be about that much at about 2 a second. Bub's thumb is only this big, so only 2 fingers are required for CPR, roughly in line with the nipples or in line with the armpits, and I'm pretty much going to press at 2 a second. Now I can hear that, which means I've got airflow going in and out, I've got a good open airway, and I'm going to deliver 30 compressions. 25, 26, 27, 28, 29, 30. Then 2 puffs. Now what this is going to do is maintain blood pressure around the baby's body, and it's going to help to oxygenate the body as well. 2 puffs and 30 compressions until the ambulance arrives. Now in the doctor's ABCD life support chart, there is a D at the end which stands for defibrillation. With babies up to 12 months, a defibrillator is not normally or generally used, quite simply because the baby's heart works a little bit differently to an adult's heart. The heart generally doesn't go into a funny beating rhythm when the person becomes clinically dead or stops breathing. So essentially there will be drugs used in this scenario, so a defib is generally not recommended for a baby of this age. That's a newborn baby. Okay, so we'll do 2 breaths and 30 compressions until the paramedics arrive, and other times to stop compressions. Okay, well other times to stop compressions would be, for example, if the baby starts to vomit during this process. So if the baby starts vomiting, stop compressions, put the baby into recovery position, a finger sweep to clear, check breathing, and if the baby is still not breathing, then we're going to start CPR or continue CPR. Now our ideal outcome here is to keep building blood pressure around the body to ensure that there's no brain or heart damage or organ damage. Okay, so that's the idea with CPR, cardiopulmonary resuscitation. All right, if we can maintain blood pressure until the experts arrive, then they can hopefully work out what's going on. Other times to stop compressions would be if the baby starts to breathe or cry. Stop, check, recovery position. Maintain good support of the baby, talking to the baby the whole time and managing the airway and the breathing. If breathing stops, be ready to start again. I also wanted to talk about, I suppose, a common scenario that people address with me, particularly new parents, and that if a baby starts to choke or has something in the airway. Now if a baby starts to choke, then choking can look a little bit like this. Now there's nothing to do here because there's air going in and out. But if Bubs gets something in the airway and this happens, then the airway is blocked generally where the vocal cords are. To get this out, we can have a look, and if we can't see it or reach it, then we're going to hold the baby pretty much by the grasp the jaw in that V sort of shape there. The palm of your hand is on the chest, leaning the baby forward and delivering some back blows. Roughly 5 back blows to see if I can replicate this. So some coughs is what I'm trying to do. What will that do? Hopefully push out the obstruction. If this doesn't work with 5 good back blows, place the baby down, call an ambulance, put it on speaker, and 5 short, sharp chest thrusts. I'm still trying to replicate that cough to get it out. In some cases, it's also okay to put the baby on the side and squash down from the side to replicate a cough to see if you can clear it. If this is not effective and the baby does not start to breathe on their own, then you will need to start CPR with 2 breaths and 30 compressions until breathing starts or the paramedics arrive. Other important things I'd really like to mention as a new parent are making sure that your baby's temperature stays fairly consistent. Now the reason for this is because babies can't regulate their own temperature effectively, and their temperature shifts can go high or low. So number 1, don't let the baby get too cold, but number 2, don't let the baby get too hot. Now when a baby starts to warm up too much, then what can start to happen is the brain can stop talking to the body. Things that warm your baby up would be things like immunisations, teething, colds and flus, and any kind of random infection that they may pick up as well. So if the baby's temperature starts to get too hot, and I'm sort of starting to push up to 38 or 39 degrees, then you need to manage this effectively. Do not let your baby get too hot, because what could happen is what's called a febrile convulsion, where the brain stops talking to the body and the body starts to convulse. This is very scary to look at, but it is generally not life-threatening if it is managed effectively. The best way to manage a febrile convulsion is, of course, to call an ambulance to find out why the temperature is so high and to start stripping the baby down. Do not think ahead too much in terms of putting the baby in a bath or a shower, because water in the airway could be very detrimental. What I'm going to do is get a damp cloth, and I'm going to start to cool the baby on the skin and fan the baby. This will generally stop the febrile convulsion or the convulsion, and also it will help to bring the temperature back down to a good stable temperature, around 37, 38 if they're a little bit sick. But if you get upwards of 39 or 40, you need to call an ambulance and you need to go to an emergency department to get the baby checked. Congratulations once again on the new bubs or the pregnancy, and we hope that you've enjoyed this little demonstration video. If you'd like any further information on first aid training or some other video footage, please go to our site at www.firstaidae.com.au and check out all of our links there.
First aid, accident and emergency. Fun, interactive first aid training.